Before you sprinkle that harmless red powder on breakfast, hear this. Cayenne can slightly boost calorie burn, but it will not melt fat by itself. It may help clear a stuffy nose, yet the strongest evidence uses a medical capsaicin spray, not kitchen powder. And for nerve pain, an 8% clinic patch can help for weeks, while most home creams fade in hours. In the next few minutes, I'll show you what's proven, what's promising, what's hype, who should avoid it, and a simple 30-day plan you can actually follow without burning your throat or your wallet. Important note, this video is for education only. It's not medical advice. If you're pregnant, have ulcers or severe reflux, or take blood thinners, blood pressure, or diabetes medications, talk to your clinician before using Cayenne regularly.
How Cayenne works. Why it feels hot. The fire in Cayenne comes from capsaicin and related compounds. They activate a nerve receptor called TRPV1. Think of TRPV1 like a tiny smoke alarm on your nerves. Capsaicin sets it off, so your body thinks it's hot. Two things happen. 1. Short term, you feel warmth, maybe sweat a little, and nearby blood vessels open up. 2. Adaptation. With regular exposure, those "this is hot" signals calm down. People who eat spicy food often tolerate it better over time. This one pathway explains most claimed effects: small boosts in energy use, appetite changes, temporary pain relief, warmth, and sometimes clearer breathing.
The claims.
Ranked. What's real versus hype? 1. Weight loss and metabolism. Capsaicin can modestly increase calorie burn and may help some people feel a little fuller. Thermogenesis. Simple. Thermogenesis just means your body uses a bit of extra energy to make heat, like switching on a tiny heater. Reality check. Expect a 1 to 3% nudge, not a fat-melting switch. Why this matters. Use Cayenne as a nudge, not a fix. The real fat loss still comes from protein, fiber, steps, and sleep. Practical use. Add a small, consistent pinch of Cayenne to meals you already eat. Eggs, soups, beans, roasted veggies. Pair with a protein-rich plate and a 10-minute walk after meals. Myth check. Morning lemon water with Cayenne melts belly fat. Enjoy it if you like, but the fat loss comes from your overall diet and movement, not the drink alone. 2. Blood pressure and heart health. You'll hear claims like, Cayenne drops high blood pressure. The fuller picture. Human studies are mixed and often neutral. Cayenne can relax blood vessels in lab settings through vasodilation triggered by nitric oxide. Vasodilation. Simple. Blood vessels relax and widen so blood flows easier. Nitric oxide. Simple. It's your body's natural open-up signal for blood vessels. Why this matters. If your BP is high, don't replace your plan with a spice. Keep meds and doctor guidance. Think of Cayenne as flavor, not therapy. Build a heart-smart plate. Plants, beans, fish, olive oil, fewer ultra-processed foods, good sleep, daily movement, stress care. 3. Pain relief, joints, nerves. This is where Cayenne can shine when used correctly. Clinic-grade capsaicin patch, 8%, can reduce certain nerve pains for weeks under medical guidance. Over-the-counter creams, 0.025 to 0.075%, can help temporarily if used consistently. Neuropathic pain. Simple. That's nerve pain. Tingling, burning, or shooting, coming from irritated or damaged nerves, not from a bruise. Topical capsaicin. Simple. A skin cream. It calms pain messages in skin nerves. It won't fix deep joint damage, but can ease surface discomfort. Safe home use. Apply a thin layer 3 to 4 times daily for 2 weeks before judging. Wash hands. Don't touch eyes or sensitive areas. Stop if irritation is strong. Expectation setting. Creams help some people, especially for surface level aches or neuropathy discomfort. Deep structural joint pain needs a bigger plan. Strength work, mobility, sleep, weight management. 4. Stuffy nose and sinuses. Many feel clearer after spicy food. Research on intranasal capsaicin sprays, made for noses, shows benefit for some chronic nasal sensitivity cases. Why this matters. Don't sniff. Inflammation and blood sugar. Early human data suggests Cayenne may slightly lower certain inflammatory markers and can help soften post-meal glucose spikes when part of a balanced meal. Postprandial glucose. Simple. That's your blood sugar after a meal. Why this matters. Steadier blood sugar means fewer crashes and cravings. Use it like this. Add a pinch of Cayenne to fiber-rich carbs like oats, beans, lentils, or sweet potatoes, and pair with protein and healthy fats. 6. Gut and microbiome. You'll see headlines about Cayenne fixing your gut. Microbiome. Simple. The billions of helpful bugs in your gut that help digest food and keep you healthy. Research here is promising, but early. Lots of animal work, small human studies. Some people feel less bloated with small, regular amounts. Others with sensitive stomachs feel worse. Rule of thumb, go low and slow. If you have reflux, ulcers, or IBS flares, Check with your clinician before experimenting. 7. Cholesterol. Some small trials suggest cayenne may help improve the HDL to LDL balance in certain people. Results are not universal. HDL versus LDL. Simple. HDL carries cholesterol away. LDL can stick to arteries. The balance matters more than any single number. Bottom line, enjoy cayenne inside a Mediterranean-style pattern. Veggies, beans, whole grains, olive oil, nuts, fish. The overall pattern does the heavy lifting. 8. Digestion and bile flow. Most bile flow claims come from animal or mechanistic research. If you feel heavy after fatty meals, a tiny pre-meal dose might make you feel warmer and more ready to digest. But don't expect miracles. Gentle try. A very small pinch of cayenne in warm water, 10 to 20 minutes before a heavier meal. If it irritates, skip it. 9. Antimicrobial properties. In the lab, capsaicin can interfere with some bacteria. That does not mean cayenne replaces antibiotics or treats infections in real life. Smart use. Cayenne in food can be part of an overall healthy kitchen, but for infections, follow medical advice. 10. Circulation and warmth. Topically, capsaicin increases local blood flow, part of why it can help with surface aches. Orally, people often feel warmer in hands and feet, but strong clinical proof is limited. If cold hands or feet are chronic, rule out iron deficiency, thyroid issues, or circulation problems with your clinician. 11. Anti-cancer headlines. You may read that capsaicin triggers self-destruct in some abnormal cells. That's preclinical research. Preclinical versus clinical. Simple. Preclinical equals lab or animal studies. Clinical equals tested in real people. Why this matters. Spices support a healthy lifestyle. They don't treat cancer. Always follow your oncology team's guidance. Safe use and doses. No heroics. Think culinary first. More is not better. Titration, simple. Start tiny, increase slowly. That's it. Simple safety habits. 1. Don't start with large doses. 2. Don't sniff powder. 3. If you overdid it, dairy, milk or yogurt cools the burn better than water. 4. Keep capsaicin away from kids and pets. Who should avoid or get medical guidance first? 1. Pregnant or breastfeeding. 2. Active ulcers, severe GERD, or inflammatory bowel flares. 3. On blood thinners or medications for blood pressure or diabetes. 4. Those with skin conditions that react to topical products. Ultra simple 30-day cayenne plan. For beginners. Week 1, tiny and safe. 1/8 of teaspoon total per day with food or 1 gentle sprinkle. Skip or reduce if you feel burning, reflux, or stomach pain. Week 2, find your comfort. Up to 1/4 teaspoon per day, split across 2 to 3 meals you already like. Optional for sore spots. Start a topical cream. 0.025 to 0.075% capsaicin. Pea-sized amount 3 to 4 times per day. Week 3, make it automatic. Stay at 1/4 teaspoon or move toward 1/2 teaspoon if comfortable. Lock in 2 go-to meals that make it effortless. Chili lime roasted chickpeas, snack. Tomato bean skillet with garlic, olive oil, herbs, and a pinch of cayenne. Add a 10-minute walk after meals for steadier blood sugar. Week 4, personalize. Choose your long-term dose. Most settle at 1/4 teaspoon per day in food. Keep what helped, drop what didn't. Track energy, sleep, digestion comfort, and any skin irritation from creams.
What to buy and what to skip. 1. Fresh peppers, firm, bright red. 2. Cayenne powder. Look for pure cayenne, no anti-caking agents. Store airtight. 3. Capsules. Reputable brands only. Food first is simpler for most people. 4. Topical creams. 0.025, 0.075% capsaicin. Start small. Skip. Do it yourself. Sniffing. Mega doses. And any claim that cayenne cures conditions. Quick FAQs. Question. Will cayenne melt belly fat? No. It's a tiny helper. Habits do the heavy lifting. Question. Can I sniff it for a blocked nose? Don't. Use proper nasal products if a clinician okays it. Question. How fast does the cream work? Warmth is fast. Pain relief builds over days of consistent use. Question. Is more better? No. More usually means more irritation. Question. Who should be careful? Ulcers or reflux, pregnant or breastfeeding, and anyone on blood thinners, BP meds, or diabetes meds. Talk to your clinician first. Cayenne pepper is not a miracle. It's a useful tool. It can nudge metabolism, help some folks with surface pain, warm you up, and make healthy food taste amazing. It's strongest when you use it consistently and safely, alongside real habits: protein, fiber, movement, sleep, and stress care. If this helped, tap like, share it with a friend who loves natural health, and subscribe to Health Fix now for clear, evidence-first guides. Want a perfect 1-2 combo with today's plan? Watch next. Black seed oil. 10 evidence-backed benefits and how to use it safely. I'll see you there.